Well, thank you so much, everyone, for joining our Mast Cell Diseases night. Tonight, we have some wonderful guest speakers who will be joining us and sharing about their experience with mast cell diseases. And so we will go ahead and get started now. So firstly, I will do an access check. So my name is Morgan. I am a white woman wearing a white sweatshirt with brown hair in a bun. We will all be introducing ourselves with visual descriptions as we are talking. And so speakers, I will ask that you do that as well upon introducing yourselves. We also have captions available for those who need them. And so you can access that by turning on the bottom panel. There should be a button that says CC for closed captioning. So just click that. And if you have any other accommodation needs that you might need for today's call, please message us in the chat and we will certainly help you get that situated. We also like to start off with an important disclaimer. So everything that we are talking about tonight, this is not direct medical advice. We recommend that you please consult your doctor for any medical concerns you might have. Each person with a condition is unique, even among individuals with the same diagnoses, and we are not experts on this topic. So, what is Invisible Illness Awareness Network? So, we are a 501(c)(3) nonprofit raising awareness about invisible illnesses, chronic illnesses, and disabilities. We support students starting affiliate organizations at their universities so that they can become leaders, educate peers, and foster inclusive environments. And so, what is the Invisibly Aware Series? So, that is what you are at tonight. We have previously always been hosting 2 monthly meetings. And so the first one being kind of a description of the condition and topic of focus for the month. And the second meeting that where we have our guest speakers come in and share about their experiences. This will be changing for upcoming months. So we will touch base on that towards the end of the presentation. But we are at our guest speaker panel tonight. And then we ask that you follow us to stay in contact with the organization. So on social media, you can find us at Instagram, that's at invisible_illness_network. You can also find us at YouTube at IIA Network. And then our website is IIANetwork.org. And you can also scan the QR code to get access to our link tree and sign up for newsletters. And then throughout today's call, if you have any questions, please do not hesitate to put them in the chat, and we will do our best to answer them to the best of our knowledge. And so now we're going to go ahead and go over some of our key takeaways from our presentation earlier this month. So as I mentioned, our topic of focus is mast cell disorders. And so what are mast cells? They are white blood cells that are found throughout the body, and they are a key part of the immune system and allergic reactions. And so they are responsible for releasing mediators that can create a wide variety of symptoms and cause certain conditions as well. And so allergic reactions occur when the immune system identifies an allergen as dangerous. And severe allergic reactions can cause anaphylaxis, which is a potentially life-threatening condition if left untreated. Mast cell diseases is an umbrella term for conditions that affect the mast cells, either because the mast cells don't act the way that they should, or because there's too many of them. There's three main types of mast cell disorders. So the first one is Mast Cell Activation Syndrome, also known as MCAS. There's mastocytosis and hereditary alpha triseptema. I totally said that wrong, or HAT. And there's also mast cancer cells as well. And so our key takeaways from MCAS that we discussed at our last meeting. So first, let's define MCAS, and that is a condition where mast cells release too many mediators too often, even when unnecessary. And so this creates a wide variety of symptoms that patients may experience. So a lot of these can be systemic. So they affect neurological, respiratory, GI, dermatological, and cardiovascular systems, creating a wide variety of symptoms. And so the triggers for MCAS vary by person, but a lot of the common triggers tend to be stress, smells, skin contact, food, medications, and hormonal fluctuations. And symptoms can occur instantaneously after reactions or up to 48 hours later. And there's a few treatments that patients might be put on for MCAS. And so the most common is antihistamines, which help to regulate the mast cells, as well as mast cell stabilizers. And then trigger avoidance. So, for example, if there's any food or certain stressors that might cause a flare up, trying to avoid those in the lifestyle can be important. For MCAS, there is a very wide ranges of estimated prevalence. And so this can go from 0.1% of people to 17% of the population. And so that's why it's really important that we understand this condition and how it can affect people who are living with it. Alrighty, so now I will go ahead and pass it over to Prabnor as she introduces our guest speakers.
Awesome. Thank you so much, Morgan. Just a quick verbal image description. My name is Prabnor. I am a South Asian woman. I have black hair and I'm wearing a navy blue t-shirt. And as Morgan said, I'm going to introduce our wonderful guest speakers today. First, just a huge thank you for taking the time to come share your experiences and be vulnerable with us. We really appreciate it. But without further ado, we are going to be speaking with Ali Jensen and Amanda Miles today. And so if both of you would like to just do like a quick little introduction about yourself and anything you want to say, also do a quick verbal image access description. And then also I will be doing questions with Annika. And so Annika, if you also want to introduce yourself at some point.
Sure. I'll introduce myself really quickly right now. My name is Annika, and I'm going to be asking you guys questions today. And again, thank you guys so much for being here. Would you like to introduce yourselves in whatever order you would like?
I can go first. Hey, y'all. My name's Amanda Miles. I use she, her pronouns. A visual description of me is I am a blonde Caucasian woman wearing glasses with green rims and a black and white shirt. And behind me, you can see white walls. I live about an hour northwest of Atlanta, and I have been living with an invisible disability since 2011. So really glad to be here and talking with y'all tonight.
Hello, everybody. My name is Alexandra Jensen. I am Caucasian with my hair up in a bun. And I've got a black sweatshirt on. And I am so happy to be with you guys. I live in Sandy, Utah. So I was born and raised here. And I have been dealing with my illnesses probably for around 12 or 13 years now, and one of them being Mast Cell Activation Syndrome.
Thank you so much for those introductions. So I guess we can just get started, dive right in. We're going to be asking questions very informally off of the question list that should be shared with you already. We might skip around depending on time. We might not get to all questions. And also, as Stephanie mentioned in the beginning, if there's any questions you would prefer not to answer, that is 100% fine. You can pass it, and whatever order you want to go in, feel free. But just to get started, our first question is, can you share your experience living with an invisible illness, chronic illness or disability? And we know that's kind of a vague question. So some things you might want to talk about would be, when did you start experiencing symptoms, and what did that look like for you navigating that really early part of that journey?
I could get started. So I started experiencing symptoms back in 2011. And for me, I was like in my 20s, and I actually had like what I thought was my dream job. Everything was wonderful until things weren't. So symptoms started coming along slowly. I noticed I was extremely fatigued. And then I started running like low-grade fevers, and my hair started falling out. And I started experiencing strange like pain symptoms, like really painful joints, painful abdomen, a lot of like GI symptoms. And I would say like as a young woman, it was extremely hard to be taken seriously. Well, I can't tell you how many doctors like looked at me and basically was like, you're fine. I can tell you're fine. You look fine. So I got a diagnosis in just under a year. And I realized that even though that felt like forever to me, that was actually a very short time for a first diagnosis for an invisible disability. So I was diagnosed with systemic lupus right at the beginning of 2012, and then a couple of years later, fibromyalgia. And then when I contracted COVID in 2023, that is what ended up leading to my MCAS diagnosis. I was diagnosed with long COVID, and then the MCAS diagnosis. So they all kind of like, as you know, with like most of these invisible disabilities, especially if it's an autoimmune disease, they kind of snowball. You get one, and then you get another, and then you get another. But for me, it has definitely showed me that our healthcare system in America is broken when it comes to treating women, when it comes to how seriously we're taken, especially when we talk about African American women. So I think that the biggest thing for me is I learned how to be my own advocate. I learned how to speak up for myself and essentially like force a doctor to take me seriously, or like break that relationship if it was going nowhere. So I would say like I have some great doctors now, but I know that that is rare and that is hard to come by. So yeah, I feel like that's a lot of I feel like I just shared a whole lot of information about a range of topics, but I feel like if you have an invisible disability, then you know exactly what I'm talking about when I mention any of those things. So really happy to be sharing with y'all tonight.
Okay, so I actually started noticing symptoms back when I was like 8 or 9. I was a really, really big dancer, and when you're dancing, you're kind of trained, especially when you're training hard, that like if you're hurting, you're kind of doing it right. And so you always kind of just move on with it. And so that's how it started. I had some issues with my feet. I was breaking bones, and I was at one point like in 2 boots at the same time. And that snowballed fast to when I was 11. I started getting a lot of bladder pain. I was having a lot of frequency, not completely like um, letting go of all the urine in one sitting. And then I was just getting more pain and joint pain, and I was already really, really hypermobile. And so that all, like you said, it snowballs really, really fast. I feel like, especially if you don't really catch it at the beginning and have the correct resources, it's easy to get down that road just because your body's so weak. And so I slowly started to get diagnosed with postural orthostatic tachycardia syndrome, hypermobile Ehlers-Danlos syndrome, mast cell activation syndrome, vascular compressions, autonomic neuropathy, and then I also have issues just with my spinal cord with spinal leaks and things like that. But um, it had changed my whole trajectory of life. I wanted to be, at Juilliard or on Broadway or something like that. I had big dreams, but my health definitely had other plans for me, which nowadays I wouldn't change it for the world. But if you would have asked me back then, I would have done anything to change it. Um, and it was really, really, really hard to get any of these diagnoses. And like you said, Amanda, a year is still feels like such a long time for you. But I know most patients have hard times finding like resources. And it took me, I am not kidding, probably 7, 8 years to really get some some kind of correct diagnosis. I need to like use that term loosely because I feel like with more evidence as research comes out, we're finding more and more out about these diseases. But I've had to get a lot of surgeries to fix vascular compressions, and I had to go completely online school. I couldn't go to college. I tried to. I had to drop out. Really, truly, it took I was functioning one day and the next day like I wasn't, and I couldn't figure it out. So I started getting like pain eating, super bad rashes, low grade fevers, hairs falling out, really bad hormonal issues, itchy and burning with the rashes, weird allergic reactions with things that like I could be eating avocados for 17 years, and then one day it's like, holy crap, I can never eat you again. Like where's my EpiPen? And so it's all just touch and go, and it is not fun, but it has taught me a lot that like you have to advocate for yourself. And it really helps to have family members advocating for you as well. But truly, it comes within and like you being your own independent person, because really you are going to be in control of your healthcare. like she said, Amanda, the US healthcare system is broken and it would take a lot in the future to ever get it somewhat right. But if we sat back forever and just like allowed things to happen the way we have, we are going to be nowhere. So I love the fact that more girls and more chronically ill people and curious people are really coming together and creating some sort of community. Sorry, that was a lot in one, but there's a loaded answer.
Please don't apologize. That was lovely. I think that was a lovely start to this. And I can see a lot of similarities in your guys' journeys together and with some of the other stories we've heard from people who have completely different conditions, but also have had to go through that struggle of self-advocation and the, as you guys both mentioned, the snowballing effect. Um, and so just knowing about your individual experiences, it means a lot to everyone here. Um, I will, sorry, detract for a moment. I forgot to do my verbal image description. I am a white woman with dark brown hair and a dark blue collared shirt today. But back to our guest speakers. I think we talked a good amount about the journey to diagnosis for you guys, since that's a really important part of the foundation that you both experienced um, of these illnesses. But I would love if you guys could both touch a little bit more on how the day-to-day of your life has changed since your symptoms started, or if there are any specific challenges that either of you face, both either physically or emotionally, socially, and if these conditions have changed your self-view at all.
That's a really good question because I think, um, so I will say that my conditions certainly changed my trajectory and it changed how, like, it really changed my career path. But um, I think I ended up like where I'm supposed to be. It definitely impacts my day to day. So with me, like, I really am struggling right now with fatigue. It has been one of the biggest like barriers for me to feel like I can like kind of like do the day-to-day things, like visit my family or go do something fun. Like, even if so say we're going to do something like some sort of outing, and it could just be like going to dinner and a movie. That takes the energy out of me so much that I have to like basically like lay in bed for like 2 days afterwards. So I think for me too, what has happened since COVID began and experiencing long COVID and experiencing and then getting the MCAS diagnosis, I definitely think differently about being out and being out amongst crowds and the worry of contracting COVID again and it making my symptoms worse. Like, so I feel like things just kind of like pile on each other one by one by one. And I think all of us invisible illness folks, we don't experience the day to day like normally. And we have to, like, sometimes there's just like a price to pay for doing the things that we want to go out and do.
I totally agree. It truly is weird because I feel like each day you don't know what body you're gonna wake up in. And there's days where like your good days, like you said, they're really not that great of days. Like if a normal person lived what we did on a good day, they would be like, oh, like all my friends always say, like, I would not be able to do it if I knew, like this was forever and this is how I feel all the time. And I'm like, well, good thing you're not doing it. Like, that's okay. We're doing it for a reason. We've learned how to like deal with it. So first off, like you have to learn how to be your own warrior and be strong and know how to attack it, advocate for yourself and vouch for yourself. But it is hard socially. It's very hard, especially since I grew up like through my teenage years with it. And having issues with friends was one of my biggest challenges just because I look fine most of the time. I mean, like, I have a port, you can see that at times. Sometimes I've been on and off TPN or feeding tubes, or I've been there's been a lot of seasons and stuff, but not everybody can tell that I'm very sick, which is great. I love it, but it doesn't help me in the way of people don't truly understand what I'm feeling. Like, I in the day-to-day live 9 out of 10 pain where I can't have a job. I'm disabled. I have to have handicap parking. Right now, I am holding my weight, trying to fight off another feeding tube. Um, for example, I just got married and I am like paying for it. And that's just like the everyday. You're used to it and you're like, "Oh, I got married. I'll be in bed for the next month." And that's okay. Like that 5 hours was worth it, you know? And you have to kind of like learn how to be okay with what you're given and how to still live life without overdoing it, but still sometimes pushing the boundaries because you can't be stuck inside in bed with the four walls 24/7. You're going to go insane. It's not going to be worth it. Like, yeah, there's going to be accidents where, oh, you're going to need your EpiPen and you're going to go anaphylaxis, or you're going to, there's going to be really bad incidents, but that's okay because it's worth it to me, at least. That's just kind of how I feel. I'm not going to sit in my house 24/7. I mean, I definitely have to listen to my body, but still. Anyway, so yeah, I can't have a job. I couldn't. I had to go to online school starting 13 years old. Dating was really, really hard, and to find somebody who understood, I had to find somebody who lived a very rough, traumatic life, so they really truly got you can go through some deep stuff, especially when you're young. Um, so once you find your community, it's great, but it's finding the community, which is really hard. And I remember feeling so alone and scared and like, well, if this is how I'm gonna feel forever, how could I? Or if there's no one to talk to about it, how could I? And so to have even just a few more resources is huge. And everybody's so lucky to have that because I remember, being like, do I really want to do this forever? Like, I need people who get me and that's very important in our community.
Thank you so much for sharing that, Alexandra and Amanda. Alexandra specifically, I feel like I really appreciate what you're talking about with the dynamic aspect of symptoms and what one day versus another looks like. That's something we talk about a lot within across all the conditions, and how much mental load that can place on having to explain yourself and constantly having to feel like, oh, explain why one day you're feeling something and one day you're not. And so I really appreciate you bringing up that mental load. And Amanda, also the kind of focus you talked about with having to really allot energy and account for how much energy and account for your days after a big outing. We talk a lot about the spoon theory here. And so just want to really recognize that and thank you for sharing that.
I also feel like, let me add something, sorry. The feeling of the being a burden is hard too. Like no matter what, if you have a million people telling you like this isn't gonna be a burden, you're not a burden, there will still be like 15% of you that no matter what, you'll feel like a burden. No matter what anybody says, anything you do. And so it's like, okay, how can I like let go of that as well and not like force someone to feel the way I feel. Like I'm like, "Oh, you think I'm a burden?" Like, we never said that. So it's even hard having to accept like your reality of like, "Oh wait, I will need to be dependent on people, but that's okay. It's okay. That's why we have community."
Thank you so much. Um, in terms of our next question, switching gears a little bit, what treatments have you tried and what has worked? Also, what has not worked? There potentially, if there were any treatments that were like absolutely no, not for you. But what did that journey kind of look like in getting treatments that worked for you?
So for me, my cardiologist is who recognized the MCAS symptoms when she was who was treating me for long COVID. And I presented with like a rash on my face, a rash on my chest, and like rashes on my arms that would just come and go all the time. And they weren't itchy, but like it was just something, it was just like a symptom. I was like, I can't even deal with this right now. So she started me out on the like histamine blockers. And it took some like trial and error. So now I take like a Singular in the morning and I take a Zyrtec at night. I take high doses of Pepcid morning and evening. And also like she tweaked, like we really worked on tweaking those doses. And then quercetin, the mast cell stabilizer, and that has really helped a lot. So I would say it took a couple months to really like get the treatment right and for me to notice that my symptoms were lessening and that I was feeling better. I wasn't like for me it was random like environmental factors that were causing flare-ups. Sometimes I could just like walk into a room or a building I hadn't been in before, and then like the rash would just appear, like hives would appear. Um, and I'm starting to notice now some like food triggers that I have to really watch. But I would say like the histamine blockers and the mast cell stabilizers are have been incredibly helpful.
Treatments are hard for myself. Because I feel like you said, they're trial and error, and so it takes sometimes years to really dial in what works for you, and then back to the snowball concept of, and then we're having more snowball on top of it. So what is what, and how can we treat each symptom, and what mud can we throw at the walls that will make it stick? And it's tough, but I've gotten on, my doctor calls it the histamine cocktail, and it's 4 different histamines. Like it's Lucas, Cromolyn, I can't even think of the other 2. And then I also do a Xolair shot, which is an allergy shot once a month as well. And I have noticed that has helped a lot, but I still deal with the rashing of my skin every single night. I'm covered head to toe. And it just kind of depends on what's causing it. I can, like, if I'm within a household that has shedding dogs, I'm covered head to toe, or random scents or different food triggers, or like certain grass, or like the most weird things that you probably wouldn't think would cause it. Or if I'm really stressed, like, or don't feel good, you can kind of, as I talk, literally just see like the rashes climb me, and you can just feel it, but you can't do anything about it. You get fans and ice, and yeah. And I feel like it's really truly about just like managing it. And a lot of treatments don't work, but once you find your correct histamine cocktail, I feel like that helps keep things just a bit more stable.
You're spot on. My partner always says he can tell when I'm not feeling well, but before I even speak, because the rash is it's climbing my neck and starting to look like feverish, and that is like usually the perfect clue that tells you exactly how I'm feeling.
Great. Thank you guys so much for being willing to share that. It's definitely sounds like a lot to go through in terms of the process of finding what works, but I'm glad you guys have both found some stuff that does work. I'm wondering, I know you guys both have a number of comorbidities, but in regards to MCAS, do you have any specifically impactful experiences regarding MCAS that are either good or bad?
I do have one, and it's kind of controversial, maybe. Um, One thing that helps me with, because with the MCAS, I get really bad pain in tandem with it. And since I found out that I'm actually allergic to a lot of metals, I have stents in my veins and I have titanium clips everywhere in my body. And so it's hard because I will always kind of be in a zone of inflammation, because those are things that we literally cannot remove out of my body. And it's interesting because there's different, like nickel I'm not allergic to, but titanium I am. And so it's like, if I just would have had those small little differences in knowledge, like my quality of life would be different. And so I always tell people, like, just be so mindful of what you're doing and putting in your body. Because I think a lot of doctors are trying anything and everything, which hallelujah to them. We have to start somewhere. But sometimes I feel like it triggers things, and then you have a bit more to clean up because you're playing science. And then you have issues from, testing out the waters. And so I just always tell people to be very particular with what they do and what they put in their body and their everyday environmental methods, like dishwasher tablets or laundry soap, or like all of those will affect your mast cells, especially one little trigger and it'll make it flare times 10.
I completely relate to what you're sharing. And for me, I was thinking of if something positive, so until I started seeing my cardiologist, I wasn't doing any sort of integrated medicine. So it was all just just like Western medicine, no supplements, and I really didn't have a doctor who had recommended anything, nor seemed to be supportive of it. And she was very much supportive of she had a whole list of supplements that she had done a ton of research on and really saw was helping patients in her cohort. So for me, that was this has been my first foray into having a doctor who was remotely supportive of any sort of something that was not just taking another medication. So that has been a really positive experience for me. And it's kind of helped me branch out to do some research and for supplements that support my other comorbidities.
Thank you so much for sharing that. Our next question focuses a little bit more on institutional structures and challenges within that. So we're wondering, what challenges have you faced within the healthcare system or in the sphere of education or potentially in the workplace? I know we touched on this a little bit at the beginning, but if you have any specific experiences that you feel comfortable sharing.
So I can share a little bit. I definitely have experienced, issues with our healthcare system, but also issues in the workplace. I think, again, it's really hard having an invisible disability. And so, right now, I work for an incredible nonprofit, and all of us are disabled. So not only are we all supported in terms of being supportive of one another and understanding where each other's coming from, but I know if I needed an accommodation, I'm not going to be retaliated against. And unfortunately, in my first experience when I was going through the process of testing to be diagnosed with lupus, I had a manager who thought and went to HR and shared that she believed I was faking my illness so I could be out of work. And I was like, oh, what a great way to be $10,000 in medical debt just to be able to work for fun. But it really taught me that there are so many people who do not understand what it's like to be chronically ill. And for me, I've carried it with me. I do have a bit of work PTSD because of what I experienced in that setting. So I find myself over explaining my symptoms or over explaining and sharing okay, I have this, and this, and that's why I need X, Y, and Z. So to be supported and whatever accommodations I need has been such a weight and burden off of my shoulders. Um, and then I will share, at least for me, the most difficult thing I've gone through in our healthcare system is I did have a doctor who didn't properly didn't explain a certain medication that I was going to be on long term and what its long term effects were. I just blindly, and this is also on me, not doing research as a young person and just trusting that this medication was going to be the right thing for me. And it ended up after I'd been on the medication for 10 years and it had really suppressed my symptoms for a long time. It also took my vision. I was diagnosed as legally blind 2 years ago. So I no longer can drive. I have no peripheral vision. I've lost my color vision and I've lost my depth perception. And that experience has definitely also made me question my doctors now anytime they're telling me something. Now I'm doing my own, which I'm sure they love. I'm also doing my own research before I take anything and trust them because, this was a renowned person in the field of rheumatology that put me on this medication and didn't share any of the potential long-term side effects with me. So I would say again, it all comes back to advocacy and like advocating for yourself in the workplace sometimes, unfortunately, and then also advocating yourself in the healthcare setting. I'm not saying that we can't trust doctors because I have incredible physicians now that I really love and trust, but I do like go behind and try to do as much research as possible on any like treatments or protocols I'm going to be put on because it is something that we're already like putting into our like weakened systems.
Yeah, I totally agree. Your work and school and that type of issue is tough because, like you said, like people just don't get like chronic illnesses are chronic and they're never going to go away. And maybe since I gained 15 pounds, I look better like malnourishment wise, but I'm still over here sitting with 9 out of 10 of pain, migraine, CSF leak, like that doesn't mean I'm feeling 100%. And I've had a lot of issues where people like a school or a job or someone would tell me, oh, you have the accommodations. Here's what we're going to do for these certain situations. And then I get in those exact situations and they choose to not accommodate me. And so it's frustrating because you can't really truly have a sustainable job like that, especially when you don't feel good or you're getting surgery all the time or you're in the ER all the time. Like, there's no way you're going to keep up, and you're really paying to survive each day. And so when you have like the systems kind of working against you, it's hard. And I sadly, couldn't end up getting my degree in college. And then also, I'm just on disability and Medicaid throughout my state because I can't physically work even a part time job. And I just don't have people who understand that. Um, and so it's really, really hard. And that's where you also lose a sense of community because socialization is great, and no matter who you are. And so it's tough. You get stuck back in the I'm alone in my room doing nothing, accomplishing nothing. And that's when you kind of have to really look for your purpose in that whole world when you can't completely, for your career that you've strived to be, whether it was me during dance, wanting to do dance, or someone to go in like wanting to be a lawyer or something. You still got to find something that's going to fill your passion, else you're going to feel like you're like, why I need a purpose to still be here, to fight, to live. And that's in a way why I've chosen to really try and advocate and be very real on social media of like who I am and what I go through on the daily, and that like life can suck, but you can still have a really great attitude and choose the best that you can be, because you're only hurting yourself in the long run, not finding your purpose and joy. And you can't let all of environmental factors suck you out of the whole 9 to 5 regular life.
I do want you to know, like, I think we live in a capital, like we live in a very capitalistic society, and so what you're producing at work or if you're not working, it like not it doesn't like your worth is not tied to that. So I'm like, I just wanted to make sure you hear that because I definitely like understand that pressure of the world being like, oh, you need to go out and work and produce, be like essentially like
Yeah.
be a cog in the wheel.
Yeah, I actually appreciate that. It is hard
Mhm.
trying to find that because you think, like, I always told myself, oh, I'll be proud of myself to, graduate high school. And then, like, you try and find your next thing to work towards. And when those things get less and less, it is harder. But you're right. It truly, when you find your passion and purpose, that's not even half of what my life would have been if I chose dance or anything in that area. I have a lot more purposeful, amazing life nowadays.
I love that message. Thank you, Amanda, for pushing that through because I think we all experience that to some degree, but especially um, when you have illnesses that are getting in the way, it must be hard to separate from that. But you're absolutely right that work does not define your worth. Um, on the topic of we kind of touched on some misconceptions that people may have either through school or the workplace, but are there any specific misconceptions that you guys have encountered about having MCAS or people's perception of MCAS? And do you have any ideas for how we can challenge them?
So it's been interesting for me because I've actually started seeing a ton of videos on TikTok where people are sharing like their experience living with MCAS. And it made me realize that I didn't know like the huge range of symptoms. And that for me has been really eye-opening. I mean, just like I knew what mine were, but like just seeing what so many other MCAS patients, like what their life is like, what their triggers are, what their treatments are, has been really eye-opening. And I love that, like we have Instagram, which is great, but it just feels like I'm sure it's just like my phone, my algorithm, like hearing me talk about it and feeding me those videos. But it's been extremely educational for me to learn um, all the different, like I said, like different different symptoms and different treatments that patients are experiencing.
I totally agree. I think social media helps so much for that. The one thing that I do think I have a bit of a hard time with is just when people are misinforming people. That's the only issue that like I have a hard time with. Um, and I do know that like not everybody's gonna know everything. It's just hard because like we're all very influenced on the internet. You know, all of us on TikTok really are. And I just hate when there's like the wrong information out there on how it happens, or I think people also have almost gotten in this like competition of like I'm more sick, no I'm more sick, and it's like it's not about that. Let's focus on, like you said, Amanda, oh wait, we all have all of these crazy amazing, not amazing symptoms, but it's amazing that we can even reach each other, and like let's create a community, let's not compete, and let's like really build each other up because we all need that. But for some reason, every once in a while, I think I have a hard time because I'm like, I just want to put more good out there than the bad. And so sometimes I just have a hard time with it.
Thank you so much. Yeah, I think that social media is as everyone talks about, such a powerful tool, but also has its cons. And I mean, I think that the community and the connection it provides is unparalleled, but definitely some frustrating things as well that come with it. Um, our next question is more focused on someone who might be newly diagnosed or suspected of having MCAS, and what advice you would give them.
So I actually have two girlfriends right now who I think may have MCAS. And I think the thing I shared with them is that it is very much like some of these other invisible illnesses in that it's hard to diagnose, and it's usually not something that can be diagnosed immediately. So even though like my doctor ran like blood test, and then but for her it ended up being like seeing how I did on I like calling it the histamine like cocktail. I think that's what I'm gonna call it now. But seeing how I did on the histamine cocktail, like that was actually the deciding factor in my diagnosis. So like realizing that it's not just going to be like a blood test and that's your checkbox. It's going to take a little while and usually takes a lot of investigation to truly get your diagnosis. And then what I'm finding is um, not, at least in the Atlanta area, it seems like not a lot of doctors are completely like up to date or truly understand MCAS. I've found other like my friends that have tried to go to like immunologists or allergists, like some of them point blank will say we're not going to treat, like we don't treat MCAS. So it's been interesting for me to learn too that, it seems to be another area where doctors are like learning about it as they go more. And I know that more patients are popping up post like COVID. It's one of the things like more POTS and more MCAS are now being diagnosed. So it seems like doctors are learning more about it as they go, just like we are.
Yeah, I totally agree with that actually. I always grew up, getting heat rashes, having all the symptoms of MCAS, but actually took me, I want to say 3 or 4 allergists and immunologists who dismiss me and say, "You're fine. You have no allergies. Oh, you're just like allergic to grass. Everybody's allergic to grass." It's like it took so much dismissal for me to get there. And I think that's hard because it discourages a lot of patients from um, advocating for themselves and continuing on to find a diagnosis. And then I also have to remember doctors are humans as well, and they're going to make mistakes and they're not going to know everything. And as long as they're like willing to learn, which that's an issue, we don't have a lot of doctors that are willing to learn because it's a lot of gray areas and blurred lines between, the POTS, the mast cell, the Ehlers-Danlos. There's a lot of fuzzy lines around there that kind of lead in with one another. But I feel like as long as we advocate for ourselves, that's back to advocacy all the way. That changes everything for yourself because you know your body the best. And I always encourage people just to you have an intuition for a reason. So really try and feel what your body's feeling, whether it's a symptom, a feeling, and really internalize it and figure out what does that mean to you. If I still felt dismissed in this moment, if they gave me a diagnosis, that doesn't mean I need to stop. I'll find someone else who will do it. So just keep on pushing for yourself and advocating for yourself is the main key to all of the chronic illnesses, I feel like.
I love it. Thank you guys so much. We are reaching some of our last questions. So we're gonna try to keep the next responses just one or two quick sentences. First is, if doctors were to know just one condition, one thing about your condition, about MCAS specifically, what would you want it to be?
Ooh, that's tough. I think I would want them to know that there is a huge range of symptoms and patients are all going to be presenting differently, but it's important to listen to us, like listen to your patients, really hear us.
I totally agree. I also think it's really important physicians to know how to use the words "I don't know." I think that's really, really important because I think sometimes they flip it, kind of make either sometimes they'll blame it on psychological issues or eating disorders or there's a lot of delusions to feed into right there is kind of sometimes what they'll say. And that's not every case. There's cases here and there, but truly, no one wants this, and we're not choosing this. No one would. It's really crappy. We're not getting any benefit over here. And so it's okay to be like, I don't know, and let me refer you, or I can look it up, or I just don't feel comfortable with that. That's pretty much it, rather than being like, no, you're crazy, or it's in your head. You need to go to the mental institution. That pushes a whole different type of mental illness on us, to be honest.
And if the public were to know one thing about your condition, what would you want it to be?
Hmm. Well, I would want the public to know about MCAS and all my other comorbidities that, just because you can't see my disability does not mean I'm not disabled. And that goes for every person with some sort of invisible disability. We're disabled. We're part of the disabled community. And to please include us, listen to us, and please support us.
I totally agree. I believe that what we go through on the daily is already hard enough. Why would we go against each other? Let's be all each other's support system and back you up and cheer you on. And I really hope that people do include us. And just because it is invisible, that does not mean we're not lying. We're not lying about our handicapped fault or anything. Truly, we're just figuring out what works best for us and allow us to do that because you are allowed to do what you need to do for your life as well.
All right, well, I think that wraps up all of our specific questions. If anyone who's here has any questions, please feel free to put them in the chat, or reach out to one of us and we can allow you to turn your audio on if you would so desire. In the meantime, I just want to say thank you guys again. You guys are absolute wonderful speakers, and we all really appreciate your willingness to share this and your experiences. And it's been really great to hear from you guys.
Yeah, just echoing Annika, thank you so much.
Thank you guys for listening. I know it's a lot of thoughts blurted out in just such a small, short amount of time. But we appreciate you guys listening and empathizing.
They're great thoughts, and I'm sorry we can't give you more time. And yeah, everyone, if you want to find Allie and Amanda on Instagram or TikTok, here are their handles. Again, feel free to put any questions in the chat.
And as we're waiting on questions, I want to give a quick shout out to Tammy Nearen from Super T's Mast Cell. She was hoping to be a guest speaker, but was not able to be a guest speaker today. Super T's Mast Cell is a nonprofit organization that raises awareness for mast cell diseases. And they also are awesome. They do grants for people who are affected by mast cell diseases. So if you have a mast cell disease and are struggling financially, I would definitely reach out to Tammy and the rest of the people at Super T's and see. They have like open application times. I don't know if they have one open currently, but if they don't have one open now, they probably will soon. So they're a great resource that I just wanted to share.
Perfect. Well, thank you so much again, everyone, for sharing. It was incredible hearing this conversation. I learned a lot about MCAS. Like, again, as Amanda said, like there's so much diversity in this condition alone that I didn't realize the degree of all the experiences that everyone has. And it's great being able to hear how you guys have personally handled it and how you can kind of bond and create this community here. So we do have a couple, or just I guess one announcement here on our next page as well, in case anyone's still thinking of some questions for the chat. Our next meeting is going to be in July. So as I said at the beginning, we are now transitioning to once a month meetings. And so at that meeting, we will have our main recap / takeaway slides on the condition we're going to be talking about, and then have some more time focused on our guest speakers, just because we know that's what you all are really interested in hearing and seeing. And we obviously love the conversations that we have. I believe, I could be wrong, our July date is actually scheduled. If it is, we can throw that in the chat. If not, you can check that on our website for signing up for our newsletter or on social media. And you can find that information on our next slide here. So again, our social media, our Instagram is at invisible_illness_network. Specifically to follow the Invisibly Aware series. You can also find that on Instagram, invisibly_aware_series. And again, our website as well. You can find any updates or announcements regarding our meetings, and you can find the Zoom link for our future calls. Thank you again, everyone, for attending tonight. If there's any remainder questions that you guys might have, again, please feel free to throw them in the chat. And thank you so much again for our lovely speakers for joining us.